A fifth Republican senator says he cannot support the GOP health care bill, not in its current form. Republicans can only afford to lose 2 votes if they hope to pass it. Nevada's Dean Heller said today he doesn't like the planned cuts to Medicaid funding. Mark Strassmann found some small-town doctors feel the same way.
We see about 130 patients per day.
Dr. Greg Mitchell practices family medicine in West Tennessee. 2/3 of his patients use Medicaid.
You see patients from how far away?
From about up to 90 miles away. They have to travel for services here to come to our hospital system and our clinic.
Because their hospitals have closed?
Yes, sir.
In the last 4 years, 4 rural hospitals within an hour's drive of here have shut down. Jackson-Madison County Hospital, the major health care facility between Memphis and Nashville, serves 17 counties.
Have you had any pain when you're at all? Much?
And attracts Medicaid patients like 22-year-old Jody Manus. Her blood pressure is high. 2 weeks ago, she gave birth to her daughter, Charlie.
That's good.
She worries about losing Medicaid coverage and paying out of pocket.
Does it worry you more for you or for them?
My kids, definitely.
1 in 5 Tennesseans relies on Medicaid, about average for a U.S. state. Medicaid covers half of Tennessee children living in small towns and rural areas. Under proposed Medicaid cuts, by one estimate, 37 more Tennessee hospitals risk major cuts or closure. Mitchell worries especially for mothers in labor.
We're having an issue for them possibly delivering babies in cars and ambulances and those type issues that would arise because of the amount of distance they have to travel to obtain care.
How do you convince people who don't live in rural areas to care about rural areas?
That's a great question, because a lot of them don't see that need.
Manus sees it. Little Charlie is supposed to see Dr. Mitchell next month. Mark Strassmann, CBS News, Jackson, Tennessee.